We've talked a lot about using oxygen in the setting of COPD, somebody with the condition called COPD. But there are certainly other conditions that would require the use of this supplemental oxygen. And sometimes people with COPD might need oxygen outside of a lung attack or a flare-up. Dr. Krishnan, can you tell us a little bit more about oxygen therapy in other conditions?
Absolutely. So by far, the most common reason that people need oxygen at home is COPD, just because it's so common. However, I think many people have heard that pneumonias can also lead to the need for oxygen, because pneumonia essentially means you have infection of the air sacs in your lung, and those air sacs are not working well enough for the oxygen you're breathing in to make its way into the bloodstream. So pneumonia is a common reason why people need oxygen. And by far the most well-known causes of pneumonia in the last couple of years that people have been talking about is COVID. So as you know, COVID is caused by a virus called SARS-CoV-2. It's a novel virus. It's a new virus that was identified a few years ago. It's obviously the cause of the pandemic. So when the SARS-CoV-2 virus is a respiratory virus, so you breathe it in, and in some cases, roughly about 10% of individuals back at the beginning of the pandemic actually developed COVID pneumonia, and those individuals needed to be hospitalized. And when you have COVID pneumonia, or actually any other kind of pneumonia, as your lungs are recovering, hopefully recovering with antibiotics or antiviral therapies, as that recovery process takes place, and you and your doctor have decided it's time to go home, your doctor will actually measure the oxygen level in your blood using a pulse oximeter, arterial blood gas, and at that time we'll need to make some decisions about whether you're still in the recovery phase but not fully yet recovered, and therefore you need to be started on oxygen. And I think we've heard a lot about oxygen shortages during the COVID pandemic, because all of these new individuals really needed oxygen as well. And it was really overwhelming the oxygen industry to be able to have enough oxygen devices and all of the things that we need to do in order to provide oxygen to individuals who've had pneumonia from COVID. So there are many causes of requiring oxygen. COPD by far is the one that I think people talk about, but pneumonia is any kind, including COVID pneumonia. Another cause is what's called pulmonary hypertension. That's a problem where the blood vessels in your lungs are not working properly. And as a result, the amount of oxygen in your lungs are not getting into the blood vessels for it to be distributed to the rest of your body. So that's another cause of requiring oxygen. And then there's some other rarer causes as well, rare causes such as interstitial lung disease or fibrotic lung diseases. And so that's another cause of requiring oxygen. And then there's some other rarer causes. There may be some problems with your heart where blood is traveling in the wrong direction in your heart, something we call shunts, right to left shunts. And in those cases, people may need oxygen to be able to breathe. And then finally, of course, there may be problems with the type of hemoglobin you have, which is the special sort of protein in your red blood cells that carry oxygen. If you have some abnormalities in your hemoglobin, you may also need oxygen. So there are many, many causes of requiring oxygen. By far and away, COPD is the most common. But in recent years, particularly during the pandemic, we've heard about COVID, but there are other causes as well. And in all these circumstances, regardless of the cause, the only way to know whether or not you need oxygen is having your oxygen level measured in your blood using a pulse oximeter or an arterial blood gas.